Hello, good evening. This is Armando Aadano, and I'll be showing you guys the mobilization that I chose with regards to the case for week 5. And this will be the CD or the video that will be for lower extremity. And patient case is about a 35-year-old female police officer who sustained multiple traumas to her right lower extremity during a work-related accident. She was sideswiped by her car while assisting a broken-down motorist. Injuries sustained were fracture of the femoral neck, ACL and MCL tears at the knee, and severe high lateral ankle sprain when she was knocked over and rolled into the median. Her accident was 8 weeks ago. She underwent open reduction internal fixation of the femur on the date of the accident and 1 week later arthroscopic repair of the ACL. She wore a walking boot for the first 6 weeks and it has been off for 2 weeks now. She has had no complication with her healing. She is otherwise very healthy and fit and released for outpatient physical therapy. She takes no medication other than occasional NSAIDs. The patient presents to you on crutches with orders for progression to full weight bearing, full range of motion training, and strengthening of the lower extremity. Her anticipated return to full duty is 3 months. The femur is completely healed. Limitation as follows: hip extension, abduction, internal rotation reduced by 50%. Knee flexion reduced 25%. Patellofemoral joint has decreased medial and inferior glides. Ankle, dorsal, and plantar flexion and eversion reduced by 50%. So for the first part of this video, I'll be showing you the glides that I chose for the hips, and we'll be starting with the physiological movements. And basically the strategy for the hip is going to be including compression and accessory glide as well to improve the limitation of motion and later on to encourage full weight bearing of the patient. So this is my patient. To start with the physiologic motion, I'll be showing you the available motion first. So flexion, based on the case, there's no limitation of motion for this, but just to include it with the treatment, I just like to show you how will I be moving the hip flexion with knee flexion, and for extension, just to clear the legs off the table, I would do some abduction for the patient, and this is already permissible since the only reduction in range of motion for the hip is 50%. So I assume the patient could go from this, and then aside from extension for the hip, I would do some hyperextension too. Hyperextension is very important for gait or ambulation for the patient, especially on initial swing, terminal stance and initial swing. So to apply the grades for physiologic movements, oh by the way, the available or normal range of motion for the hyperextension could go to 45 to 60 degrees going down from this position. So for grade 1, that would be a small oscillation, resistance free, and for grade 2 it will be larger but still resistance free, large amplitude, and then for grade 3 will be up to the limitation of motion, and it's going to be large amplitude. And as you can see, the return from the limitation of motion will be going even up to the original position. And for the grade 4, it will be reaching to the limitation and the return will be smaller. So again, this will be grade 1. grade 2, grade 3, the limitation, but large return, and grade 4 will be to the limit and small oscillation. For the abduction, from this position, you're going to be moving the lower extremity away from the midline, going this way, and I would assume the patient could go 50% of it, of the range of motion, and available range for abduction will be 0 to 45, so half will be here. So just to show you, the grade 1 for this will be just very small amplitude. Grade 2 will be larger. Grade 3 to the limit and still large amplitude. Grade 4 will be to the limit but small amplitude. Grade 1, grade 2, grade 3 to the limit, and grade 4. And for the internal rotation, I just like to show you the internal rotation since I want to be more concise with this video. The PT stance will be at the side, facing left side of the patient, and then left hand will be under the thigh, and then my right hand will be grabbing the distal leg, and the motion will be patient's lower leg or the tibia will be away from the midline. I hope you can see it from there. So grade 1 will be small amplitude, you're barely moving the extremity, and grade 2 will be larger but still resistance free. Grade 3 will be to the limit, and grade 4 will be to the limit but small amplitude, and the return will be smaller from the limitation of from the end range. So grade 1 will be small amplitude, grade 2 will be larger, resistance free, grade 3 will be to the limit, grade 4 will be to the limit but small amplitude or shorter return. So okay, now just for the sake of being easy for the patient here, my patient over here, I'll be showing you the glide or the mobilization for internal rotation since we're already here in this position. So I incorporated the glide for internal rotation with compression, since the main rationale for the addition of compression is to encourage the patient to have better full weight bearing. So patient position is still supine, and we can bend the hip to normal, or this would be good. This would be the approximately the loose back position of the hip, and then right hand will be distal on the distal thigh, and my left hand will be on the distal leg. And what we'll be doing here is internal rotation from the midline, or we can also start from external rotation going to internal. However, the special thing about this mobilization will be the addition of the compression. So from this hand placement here, you'll be adding compression, the motion or direction going to the hip of the patient while you move it to internal and external rotation. So right hand will push. You can initially do some oscillation. Grade 1 will be barely moving the area. Grade 2 will be resistance free but larger. Grade 3 will be to the limit but still large amplitude. Grade 4 will be to the limit and then oscillate, small range. Okay, while you move the lower extremity to internal, or the hip to internal rotation, external rotation, apply the sustained compression to the hip going proximal, and then you can move this external rotation first, going to internal rotation. In going to internal rotation, if it is limited, you can start from grade 1, and grade 2 will be large amplitude. You can even pass the midline, and then go into internal rotation, grade 3 to the limit, and then back to the midline or back to external rotation. And then grade 4 will be to the limit of internal rotation, but the return will be short to give you a small amplitude of mobilization. And as you can see, well, you don't really see over there, but my compression here to the hip is sustained since I started this motion. So, okay, let me rest for a minute. We'll do it again. Compress, and then grade 1, grade 2, still resistance free, grade 3 to the limit, large amplitude, grade 4 to the limit, and small amplitude. So my motion is internal, external rotation, focusing more on internal rotation. Okay, for the second part of the internal rotation, I'll be asking the patient to lie down to the side, facing the wall, over there. Okay, I hope you can still see me from there. So, in addition to compression going to the head of the patient, or going to superiorly to the hip, you can also apply compression against the hip going medially. And the reason why I chose this is during gait activity, it's not only compression going superiorly is what's happening. Our body is dynamic, and it also involves some medial compression to the hip. So if we want a more dynamic movement or more normal movement when the patient starts to ambulate, we should incorporate rotation, focusing in this, mobilization, focusing on internal rotation, plus compression going to the medial side. So I'm showing that I'll be pushing from here, going medially, while I internally or externally rotate the hip. But I just want to repeat it again. My focus here would be internal rotation. Okay? So hand placement will be the greater trochanter of the hip, and then my left hand will be grasping my arm will be under the distal thigh, and my hand will be grasping the calf of the patient, approximately in the middle of the leg. And here's my pressure going medially. You can start with some oscillation going medially. So grade 1 will be just barely moving it, barely moving the greater trochanter. And grade 2 will be larger, but still resistance free. Grade 3 will be to the limit, but still large amplitude. Grade 4 will be to the limit, but small oscillation or small amplitude. And if you wanna, or if you're ready to move the leg now to internal rotation, you have to squeeze or press the greater trochanter sustained, going to the medial. So if you can see that, I press it medially and I move the leg, internal rotation, okay, up to the available range of motion. And you can even apply the gradings in this mobilization. So if you want to do that, press medially, compress medially, and then grade 1 will be barely moving the leg to internal rotation. Grade 2 will be larger but still resistance free. Grade 3 will be to the limit, large amplitude. And grade 4 will be to the limit but small amplitude. Okay, so that's it for the internal rotation, incorporating compression going superiorly and then compression going to medial side of the thigh. So I'll be asking my patient here to lie down to the other end of the table to show you the other mobilization. So right now, we want the hip to be better in terms of range of motion for the direction of extension. And based on concave and convex rule, the articulating side for the hip is convex. So if we want to encourage extension, we should be applying anterior glide. So so for this, if you can see me from there, so this is still the right hip, and it's better to have a patient pillow between the knees and side lying position. So you have to locate the greater trochanter. So if you're having hard time locating it, you might want to do some passive internal and external rotation, and then you feel the greater trochanter here moving. So once you feel it, just rest the leg, rest the patient's leg, and then using the thumb and with your fingers in front of the patient's hip, what you'll be doing here is gliding it, going anteriorly. So the motion will be going that way. So if you want to apply grade 1, will be barely moving the hip, small amplitude of oscillation. And then grade 2 will be larger, but still resistance free. And then grade 3 will be to the limit, then still large, and the motion I mean the pressure or the push coming from you will be coming from your body for proper, you know, PT stance, and so you don't injure your thumb and hands. And for the grade 4, to the limit, and then oscillate small amplitude. Okay. Okay. Supine. And this time, I'll be changing the position of the patient, going to supine, just to show you the other glides that's going to be important for the patient. And this will be using the caudal glide, in particular it's called longitudinal movement caudad. And the patient here is in supine, so I should have started with side lying. However, yeah, I could ask the patient again to move to the side lying position. Okay. So if you want to do that glide, your hand placement will be the middle of the thigh, and the direction of motion will be going caudally, going to the inferior direction. So it's going to be just pulling the patient's thigh. So you're incorporating those mobilization grades. Grade 1 will be just barely moving it. Grade 2 will be larger, still resistance free. Grade 3 will be larger, but to the limit. Grade 4 to the limit, but small amplitude. And you can even go back to 3 if you want. Or grade 2 if the patient is hurting. Okay, and according to the textbook, if you're doing grade 3 and grade 4, she has some other recommended position for this, and this is in supine motion. I mean supine position. So like this, without the pillow, and you can bend the hip to flexion, and the most important here is you brace the knee to your sternum, and hand placement will be in front of the proximal area of the thigh, and your direction of mobilization going to be going to the foot of the patient, since what we want is inferior glide. So you can do some oscillation. What I'm doing right now is to the limit, large amplitude. So this should be grade 3. If you want grade 4, it's going to be to the limit, but small amplitude for oscillation. And you can go back to 3. And 4. Okay. That's it for extension. And next will be glide directed to increase the abduction for the hip. And again, the glides for this includes 2 positions for the patient. One is side lying and one is supine. And I could ask the patient again to go to side lying for grade 1 and 2. And hand placement here will be similar to the longitudinal movement caudally. So the thigh, now you're gonna brace the thigh right here with both hands, and you're gonna move it up, going laterally, or going to a lateral side of the hip. So just to show it to you, I'm going this way. So you can do grade 1, barely moving the hip. Grade 2 will be large amplitude, but still resistance free. And you know, based on my experience, I could do some grade 3 and 4 for this. I can move it to the limit, but still large amplitude, and even to grade 4 to the limit, but small oscillation or shorter return. Okay, so based on the textbook, the recommended position for grade 3 and grade 4 would be supine. And again, you have to brace the knee against your chest or against your sternum, and hand placement, instead of the front of the hip, it will be the medial side of the thigh, or your proximal thigh, proximal and medial aspect of the thigh. So your motion will be going to you as the therapist. So going that way, going laterally. So again, hand placement will be proximal and medial side of the thigh, but mobilization will be going laterally. So grade 3 will be large amplitude to the limit. Grade 4 will be to the limit, but small amplitude or small oscillation. You can go back to 3, and then 4 to the limit, and small oscillation. Okay, so just to recap, what I've shown you initially was physiologic motion in supine, including extension, hyperextension, abduction, and internal external rotation, focusing on internal rotation. And then second was glides for internal rotation, having compression as an additional component for that in supine and side lying. And then third was mobilization to increase hip extension, and I use the anterior glide, since the articulating side of the hip is convex. And then fourth was longitudinal movement caudad in side lying position, wherein grade 1 and grade 2 was in side lying, and grade 3 and grade 4 was in supine, also as recommended in the textbook. And the fifth one was to increase abduction, wherein we did it at first in side lying for the grade 1 and 2, and in supine position for grade 3 and 4. So this video will be continued later for the knee and ankle part. Thank you for viewing.